What are allodynia and hyperalgesia for fibromyalgia pain? Imagine feeling pain from something as gentle as a light touch or a soft breeze. That's what happens with allodynia, a common symptom in fibromyalgia. It's when stimuli that normally shouldn't cause pain, like clothing or a gentle pat, suddenly become painful. This occurs because the nervous system becomes overly sensitive, a process called central sensitization, which makes the brain interpret normal sensations as painful. Hyperalgesia is a bit different. It's when stimuli that are usually painful, like pressure or a pinprick, cause an exaggerated pain response. So, if someone with hyperalgesia presses on their skin, they might feel pain that's much more intense than expected. Both allodynia and hyperalgesia are types of neuropathic pain, meaning they originate from nerve dysfunction rather than tissue damage. They often happen together in fibromyalgia, making pain feel more intense and widespread. In fibromyalgia, these conditions are linked to changes in how the brain and spinal cord process pain signals. This altered processing leads to heightened sensitivity to both painful and non-painful stimuli. For example, light touch or temperature changes can trigger pain responses that are out of proportion to the actual stimulus. This is because the nervous system's threshold for pain is lowered, and its response to stimuli is amplified. There are different types of allodynia seen in fibromyalgia. Tactile allodynia causes pain from gentle touch or pressure, like when clothing or bedding irritates the skin. Thermal allodynia makes temperature changes painful, so cold water or heat might trigger discomfort. Mechanical allodynia involves pain from moving stimuli, such as brushing the skin or stroking it, which can make everyday activities like showering or dressing difficult. Beyond touch, people with fibromyalgia and allodynia often become more sensitive to sounds, lights, and smells. This heightened sensory awareness can lead to sensory overload, causing headaches, dizziness, or nausea. These symptoms reflected how the nervous system's processing of external stimuli becomes dysfunctional, contributing to the overall picture of central nervous system hypersensitivity. Allodynia and hyperalgesia usually come with other fibromyalgia symptoms like fatigue, sleep problems, muscle aches, and brain fog. The presence of allodynia often indicates more severe central sensitization, which can mean a higher overall symptom burden. Recognizing these sensitivities is crucial because they influence how we approach pain management. Since these conditions stem from changes in the nervous system rather than tissue damage, traditional pain treatments may not always be effective. Instead, managing triggers becomes key. For example, avoiding certain types of touch or temperature extremes can help prevent flare-ups. It's also important to tailor treatments to each person's specific sensitivities, as what triggers pain for one person might not for another. Understanding allodynia and hyperalgesia helps both patients and healthcare providers develop better strategies for reducing pain, flare-ups, and managing symptoms. It emphasizes the importance of gentle, individualized approaches and avoiding treatments that might worsen nerve sensitivity. Always consult with a healthcare professional to create a safe and effective plan tailored to your unique experience with fibromyalgia.